Hi, good afternoon. This is Yamilet Zegarra, and I am from Family Resource Network. This time, I would like to introduce saying that it is time for open enrollment process for health insurance. We already started November 1st, and I'm here to support and to help you with the application process, and we're gonna go indeed for that today, okay? If you happen to have any questions, feel free to reach me out by email or phone number at the end of the presentation, okay? Thank you. So getting started with your enrollment can be a headache. I have a lot of people asking like, how can I do it? I'm an employee, or perhaps my income has changed. I have a new baby, things like that. It is always tedious with health insurance, and that's understandable. But I'm here to help you to that process. And the good news is that it is for free. We, Family Resource Network, as a nonprofit organization, we work with the state, and we are certified navigators bilingual to understand and to help you out to answer those questions that might be tricky in the application. Now, we have to make sure that there is an affordable and a good quality healthcare in New Jersey. We need to understand also that New Jersey, it is asking for every resident within the state as a mandatory to enroll. It is important to understand this because at the end of the year, when you have to do your taxes, you may have to pay a penalty either for each day or each month that you were not covered, or just simply because you didn't have insurance, okay? So we have to be very careful with that. Now we're gonna help you to browse different plans. We can compare cost and benefits. And I like to stop there because it is important to understand what type of health do you have. If you are the type of person that only goes to the medical center for preventing services, let's say, then you're probably going to visit just for what, 4, 5 visits there. So that insurance, an insurance that might not cover everything, but it will have like a lower premium payment, which means monthly payment, could be affordable for you, and you can actually use it. The difference is when you have a chronic condition that you have to be monitored every month, and you have to go to the hospital several times, or that you know that your treatment required for you to be in the hospital for more than 3 days there, right? So it's different. It's always important to check what type of insurance are you looking for, and also what type of insurance will cover your medication. In Get Cover NJ, we can always reapply. If you have changes in the 2021 or 2022, we can always renew it, okay? Make sure that let us know if we are the ones helping you with the application. Let us know what has changed in your life. Maybe there was a life event, you know, you were pregnant, you gave birth, now you have a baby. And we need to make sure that we can tell to the insurance and let them know that your income has changed, because that's an extra expensive. So we have to make sure of that. So that way we can have a better health insurance and more coverage as well. Now, the question is, who can be in the marketplace? Marketplace is a place where you can do the shop for your health insurance. And at the end of the application, you will be given more than 5 options. And then you're going to check which ones are the ones. But in that case, the require information or paperwork, let's say, is you have to be a primary NJ resident. You have to be a resident of the US and an NJ for taxes, meaning that you're paying taxes, you work here in New Jersey, US citizen. And if you are not a US citizen, then permanent residents, we are going to ask for the green card numbers that are located there. Very important, okay, because we need to put that information into the application. If we don't put that, we are not able to continue. never being in jail. And the minimum required is that if you are here as an employee by any company, then you're supposed to have an employment ID as well as the Social Security. And that will be enough to get you registered in Health Insurance Marketplace, Get Cover NJ. Okay. Just to mention also, Medicaid, which is NJ FamilyCare, we can always register you in Marketplace, Get Cover NJ, just once, and the system, depending on your income, will determine if you belong to NJ Family for Medicaid or Medicare, if it's the case. But it is only one application required. I always suggest to do it in Get Cover NJ because we can have only one application going to two different systems, and depending on the information and the income of the previous year, we're going to find out which one is the best for you. In the case that you are qualifying for Medicaid, we have to say that there are special navigators belonging to NJ FamilyCare, and in that case, if your application is saying that you belong to Medicaid, that means that you are going to get in contact with a person or a navigator from that department. Okay, it's a little different, but it is only one application that needed to be find out what is the reason. And also for Medicaid, you must be a resident and you must be living in New Jersey for 5 years. Okay. Less than that, you are not able to apply for Medicaid. That's a big requirement right now. In that case, we're going to talk about what exactly do you need to apply. As mentioned here, home and mailing address, date of birth, social security number, very important, documentation for legal immigrants, if applicable, employer and income information, the estimated amount of 2022, how much do you do last time in taxes, so that's what we're going to use, and any policy number of the current employment. If you have, for example, some people have COBRA and they know that they're going to finish in 6 or in a year or 18 months later, right? We have to make sure that we can mention all that also in the application. And now the plan comparison tool, meaning that monthly premiums is nothing more like the monthly payment that you are doing every time. It could be $1, it could be $600. It is important to understand that the whole medical system, when they ask for health insurance is always expensive, okay? But the good news is that the state is going to help you with it. Let's say if just to give you an example, health insurance might cost $600 monthly, but the state will tell you, because you have this type of income, we can help you paying. The cost is $600, but the state is going to pay $500, so you end up paying only $100 monthly, correct? So that's the way how the state will help you. Okay, it is important to understand the portion, because sometimes we assume that minimum payment is really high, $50, $100, and $200, but in reality, the price of the health insurance it goes beyond that. It's a lot. And then it's going to cover doctors. It's going to do the yearly total cost. It will tell you how much is costing the whole year. And like I mentioned before, the state is going to help you financially, meaning that they're going to help you to pay the insurance, okay, monthly. The type of financial assistance, as I was mentioning, for example, unemployment recipients, some consumers receive additional APTC, which is tax credits. That's what I was saying, actually, in regards to helping you out with the copayment and reducing also some prices. That's why some people come out with $1 and other people come out with $600, right? Depending on the income, depending on the answers that they given into the application, the system will automatically find out whether you apply or whether you are qualifying for any type of support or financial assistance in that case. And we have the premium taxes credit, which means that this will help you to lower the price. That's what I was mentioned before. The cost sharing reductions, that's like the deductible, meaning that the state is going to give you some extra money in a car. It's going to give you your car for insurance in another type of debit card, let's say, putting money there, so that way when you have to pay the copayment at the registrar, or you own some money, so you have to use the money for that, right? It's like very similar to those that are some jobs offer that type of debit card, HSA, I believe it's called. So something similar, it will happen at this point also. And yes, if you're using the marketplace, you can always apply for dental and eye doctors as well, ophthalmology car. So they're actually less expensive than the regular health insurance, probably $9 more or $5 more. The American Rescue Plan is just asking or telling you what is the income level. 51,000 a year for an individual, 104, 800 for a family of 4, meaning that if you are below that, you are definitely qualifying for getting cover, or at least to get some help to obtain the health insurance. Okay, that was effective May 1st, 2021. Still going through all the 2023, and I really hope that they don't make any changes. Well, like I mentioned before, everything is qualifying in income. And the application is always in Get Coverage J. That's the only platform that we are using at this point. We used to have the other one that was connected with the other 50 states, but I'm glad that New Jersey separated itself just for New Jersey. Because it makes it easier, faster, and it makes you qualify in time manner, which is really good. And it's not collapsing like the previous system that we used to have. So at this point, it's pretty good. When we say free or low cost, we are just saying that there are, like I mentioned, people that are getting free, which means Medicaid, and a low cost, $1, $2, $10, $15, and so. Again, everything depends on the income, okay? Well, who can help you? You can always call or visit the website Get Coverage J, and there are plenty of navigators there. Or you can always, come to Family Resource Network. Our website is available. We have navigators that are bilingual, English and Spanish. And we can help you with that, with many questions. And I understand the application is a little tedious to go over, but like I said, tricky questions may end up in high cost for health insurance. So we just want you to make sure that you can qualify for an affordable health insurance, or at least that you can qualify for Medicaid if it's the case, right? Just remember to come back with any application throughout the year. Let's say, how much did you do last year? Let's say, what are your expenses? This is something that we don't, in the application, people don't say, but I like to mention that to every consumer when I'm helping them. Make sure to write down your expenses during a month. Why it is important? Because we all have expenses, and we have to make sure that the application understand, or at least the system understand, that you are also having expenses, like say bill utilities, car insurance, mortgage, rent, anything. We have to let them know, because that's the only way that they can evaluate your expenses toward your income, and you are going to be able to get better health insurance, or at least affordable one. If we don't mention that, I don't know why, but this obviously the system is going to tell you, okay, you don't have any expenses, so that's what you earn, but that's it, no expenses. So I'm going to give you something. I guess you are available to get this type of insurance, and you can afford this type of insurance, whether it's $600 or $700, right? So we don't want that. We want to make sure that you can get the best for your health and the best affordable health care, right? In that case, make sure to always gather all this information. If you have any questions, just feel free to reach me, my email and or my phone number that I'm just going to put in a few minutes. This is the email address for Family Resource Network. You can always get in contact with us. That's the phone number. and just go and visit us. Let us know how can we help you. I like to do appointments because usually it takes about 30 to 40 minutes, if not more than that, when they recently moved to New Jersey. And then, it's important. Just make sure that you can do it throughout this month, because once we get to December, January, it gets really, really hard to get in contact with a navigator, because they are pretty busy, and because open enrollment is closing. So you have to make sure that you can get in contact as soon as possible, okay? And again, thank you so much. My name is Yamilet Zegarra, MHA Health Resource Coordinator from Family Resource Network. And you can always call me. My phone number is 609-276-9595. Thank you.